Hi, I'm Cindy Olsen, and this is Senior Beat. Today we are at City Municipal Building in Groton, and we are with Magnussen of Untitled Health District and Communicable Prevention Disease Supervisor.
Yes, it's a mouthful.
And what are your other titles?
I oversee Medical Reserve Corps as well as Public Health Emergency Preparedness.
Wow.
But I don't do it all by myself.
You do. You have quite a team, don't you?
Very, very fortunate. These are, for the most part, all Medical Reserve Corps volunteers. There's no way that we could be providing these clinics.
That's awesome. So just so you know, today we are here for coronavirus-19 vaccination.
Yep.
Untitled Health District is providing that. And today we are doing 65 and older.
Yes, we're doing second doses. We've been doing this now for 8 weeks.
Perfect.
And each week we get a little more vaccine, which is great. And so today's clinic is actually 65 years and older, second shot. Sunday we're going to do a drive-through in Waterford. That'll be 65 years and up. And then next Wednesday we'll start with the 55 and up. March 1st is the date for 55 and up.
And that is the first dose?
First dose.
Perfect. Okay. Yep. So, like you said, you have quite a team. How are you pulling this off at the office and then at these clinics?
Well, it's a great administration that backs us up, our director and deputy director, as well as we've got a great staff. And I've got, at this point, probably close to 400 volunteers.
That's amazing.
We're very dedicated. As you can see, with the blue vests, these are part of a national program, Medical Reserve Corps. So today we have a lot of physicians, nurses, dentists, teachers, lots of backgrounds here.
That's awesome. I love it. So today we're here at the Municipal Building. You said next week you're going to be in Waterford, and then you're going to be back in Groton again.
We'll be back here next Wednesday, and not 100% sure of the times yet.
Right.
This is a great location. It's kind of central. It's right off the highway. And it's a nice big area. I know it looks a little crowded right now, but we're still maintaining social distancing and the masks and everything. And hopefully, we're hoping to do 600-700 doses next Wednesday.
Right. Now, so Untitled Health District oversees 151,000 residents of New London County. What are the towns that are included in that?
So you start at the Connecticut River, Lyme and Old Lyme, and then you go to East Lyme, Waterford, New London, Groton, City of Groton, North Stonington, Ledyard.
Oh, wow. So you are covering a lot of bases for us. So we appreciate that.
Oh, well.
Groton is just one part of it. And I know, being that I work at the Senior Center, we hear a lot from the Groton seniors, why aren't there more clinics in Groton? Why is CVS not doing it? Why is it Walgreens? So for us, for you to have these clinics is a blessing. We appreciate it. We know the seniors do.
Well, the issue is that hasn't been much vaccine.
Right.
And the bigger issue is the fact that we want to maintain social distancing. We want people to wear masks. And so you want to find areas that are big and safe. And the other thing is the Moderna and the Pfizer vaccine is very fragile. So we can't be taking that from place to place. We bubble wrap it to carry it here. So we have to be very, very careful, and it can only be out for a certain period of time. So that's why you don't see clinics popping up all over.
Okay, so then with the bubble wrapping and the whole Moderna thing, that's a really good thing for people to know. Can we talk about more of which vaccine are you distributing?
We're using Moderna. And so there's 2 doses, 28 days apart. Not everybody's going to make it back on the 28th day. So there's certainly leeway. So don't get panicked if you can't get back for it. And everybody will be getting a card afterwards that shows that they got the vaccine, and they want to keep track of that.
Right.
Because who knows, in the future you may have to show proof with travel or coming into a venue. We don't know.
Right. We actually were discussing that earlier today at the Senior Center. Will we need these cards to show that we're okay to go somewhere? So I like that. Thank you for bringing that up.
But I do want to say one thing, because we're getting a lot of calls from seniors saying, why can't we start back with our activities? We've been vaccinated. And so I just want to say that just be patient. That's not something that can be just done quickly. And just because you've been vaccinated doesn't mean that you stop wearing masks, doesn't mean you don't social distance. So there's got to be a lot of thought going into this before activities open up again for the seniors. I know that everybody is very anxious to get back to the senior center and do things with all of you.
Yeah, so and we want that too. Yeah, we will definitely be doing masks and safe distancing, and that we will definitely be doing for the senior center. And if you can't, we can't have you in. We're going to take a quick break, and then we'll be right back on Senior Bee.
By now, you've heard the good news. Connecticut is vaccinating our residents to help prevent the spread of COVID-19.
The vaccines have been thoroughly tested. They're safe and they're saving lives.
We're now vaccinating our highest risk residents, but that's just the start.
Vacunarse le protege a usted, a sus seres queridos y a nuestra comunidad.
Getting vaccinated is how we get back to normal.
Keep checking this website to see when, where, and how you can get vaccinated.
Welcome back. We are at Groton City Municipal Building today with Ledgelight Health District. Chris had to step away. She's needed. So instead we now have Director of Health of Ledgelight Health District, Steve Mansfield. Thank you, Steve, for stepping in.
Oh, you're welcome.
We were just talking about that even after the vaccination, what people still need to be doing and how to still keep safe.
Right. So the most important thing to remember is that although the vaccine does confer immunity to the population, we haven't had vaccinated people around long enough to actually know that they're not going to be able to, say, acquire the disease and pass it on. So the whole purpose of the vaccine is to make sure that people don't get ill. It's to reduce morbidity and mortality, but they still can become infected with COVID and potentially pass it on.
Right.
I think as time goes by, it will be more likely that we'll have enough evidence, enough data to say that, okay, maybe you don't have to follow the same precautions.
Right.
For instance, the governor's office may decide at some point to lift the travel restrictions for people who have received their first and second dose, because they're going to have enough immunity that them traveling to another area and coming back won't increase the risk for everyone else.
Right. But we might still see that you're required to wear a mask when doing so.
Exactly. So right now, regardless of your vaccination status, you should still maintain social distancing. You should still always wear your masks.
Right. Wash your hands a lot.
Exactly. All the things you've been doing, those mitigation measures you've been doing to keep you and your family safe, should continue, despite the fact that you've gotten the vaccine. The vaccine is to keep you safe and keep you from getting ill. But all the same mitigation measures should continue. Okay,
perfect. Because I think it's really important for our audience to know that just because you got the shot doesn't mean you're good to go and you're a superhero now.
Right, exactly.
Although you are a superhero by getting it, we love that.
Yep, for sure.
So with that said, there are going to still be places that aren't going to allow you in if you are not doing the suggested or the required things.
Exactly, and all the the public facilities that people go to, the gyms and restaurants, they still have to adhere to all of the sector guidance rules. Again, regardless of vaccination status, all the rules are still the same. Now we're hopeful as time goes by that the rules will change and things will become more relaxed. But we've seen a significant decrease in the number of cases in our jurisdiction over the past 2 months, which is great. I think we've had 6 consecutive reporting periods where we've had a decline.
Decrease, awesome.
But we don't want to see it go back up, or we don't know what's going to happen with the new variants in our communities.
True.
So if those new variants come in and they're more transmissible, then our rates could go back up. And the last thing we want to do is go backwards and have to put in place more restrictive controls to keep people from transmitting. So it's not a time to let down our guard. It's a time to remain diligent in keeping up all those mitigation measures to keep ourselves safe.
Okay, I appreciate that, because that's something I think a lot of us needed to hear, and we might have to hear it over and over again.
Right, absolutely.
We border Massachusetts, we border Rhode Island, we have New York just over the water. So we hear a lot of different things, but how's Connecticut doing overall?
they're doing really well across the United States. You know, the number of people who have been vaccinated, the proportion of people who have been vaccinated over age 65 is really good. So
Great.
I think our plan is working really well. And as everyone has probably heard, the governor said as of March 1st, everybody over age 55 and those who work in either child care settings or in school settings are going to be eligible. And that's great. So we've been working in partnership with Yale New Haven Health Systems, Hartford Healthcare, and Uncas Health District to set up a plan to make sure all of those populations are vaccinated.
Great.
So we just actually communicated with all of our superintendents and our daycare providers earlier today to let them know we'll be communicating with them about specific designated clinic times. And these clinics that will be set up will be specifically for those populations. They won't be open to the public. So if you're a teacher, if you're an administrator in a school system, if you work in a daycare center, we're very confident. Exactly. We'll be very confident that you will be able to get vaccinated before the end of the March. And that's what the governor's office has asked us to do, to make sure that all of those populations are vaccinated by the end of March. And we have a plan in place, and it has a lot to do with the really great partnerships that we've been developing in southeastern Connecticut over the years. So when we heard about the governor's initiative to get these populations vaccinated, we pulled together our group, came up with a plan, and then disseminated that information to our superintendents.
That's fantastic. As far as, you know, the new age group opening up, there's a lot of, and we hear it at the senior center especially, well, why are they opening it up to this group already when not all of us have been vaccinated? Is there a worry that with this new population, which I don't know the numbers there, you know, how many more people that's going to open up towards, I need to be vaccinated? Is there a worry that some people are going to be left behind?
Yeah, there is a concern that that's going to happen because there are so many people who are eligible now. You know, it was 75 and over, 65 and over, and we're still seeing at a lot of our clinics, this happens to be a second dose clinic, but we're still seeing a lot of that population who hasn't been vaccinated. I think the intention is to get as much vaccination into the population as quickly and efficiently as possible. And the governor's office made the decision not to go with people with underlying medical conditions because there were a lot of complications there. And of course, that's the decision of the governor's office and the allocation committee. They tell us what we're supposed to do and who we have to vaccinate. But one of the greatest things about partnering with our hospital systems to vaccinate those school personnel and the daycare providers, the people who provide services to children, we're allowed to then focus our activities in our vaccination clinics on those folks who may be underserved. So we can focus on the 65 and 75 plus. We can focus on, for instance, minimum wage workers who work in restaurants or other industries in our community. So we spend a lot of time doing outreach to those individuals in our communities who may be underserved, not be able to get to a clinic, not be computer literate or have an email address. So we've set up our registration system so that it's easy to do. So once the hospital systems begin to vaccinate the school and the child care professionals, then we can focus on those groups. And that's what we're going to continue to do.
Great. Can we kind of just step back a little bit, talk about how somebody can register for the vaccination? Like you said, our older population may not be as tech savvy, and we're hearing a lot of that over at our place, and we're trying to help. And I happen to know because I've called, and your staff has been amazing and most helpful, but sometimes your phones are just nonstop. You just don't have any more appointments. And one thing we're telling people is just be patient. You got to be patient, and we are trying to get to you, and we're trying to get you vaccinated as well. But so for somebody who might be new at this and has not even tried yet, what do they do? Do they call? Where do they go for this information?
Yeah, the best thing to do, well, back up just a little bit. So I'm sure a lot of people have heard about the VAM system, the Vaccine Access Management Systems. And that worked well with certain populations where you're uploading large lists of people, but it doesn't work well for individuals and those that may be limited in their ability to register. There's a two-factor authentication process. So it was only available in English. That was a difficult thing. It didn't have a call-in number, so it was all internet-based. So Ledge-Light Health District basically petitioned the Department of Public Health and said, we want to do it our own. We did this
thank you.
about 12 years ago with H1N1. We set up our own registration system. So we basically emulated what we did then, put it back in place. So now if someone in our community wants to register for one of our clinics, they simply go to our website, click on a link, answer about 32 questions. It takes about 4 minutes. Really, most of them are you male, female, do you live in Connecticut,
yes
do you
or
work
no?
in Connecticut?
Yeah.
Very simple questions, a few about allergies and so forth. And then you register for the clinic. It's as simple as that. Now, the limiting factor right now is the fact that we're not getting a lot of vaccine.
Right.
This week we received, I believe, 900 doses, 600 first doses, and then 300 second doses. And this is a 300-dose clinic today. So that's one of our biggest limiting factors is there isn't a lot of vaccine available. So we're hoping that the vaccine will become more plentiful. And then back to your question about 55 plus, that's what's going to allow us to vaccinate a much bigger swath of our population.
So with all that said, I know that one of the big things was the seniors who don't have email address, or a couple have one email address. Is email address required for your system?
No, it isn't.
Perfect.
So you really don't need anything. You don't even need a phone number. If you call Ledge-Light Health District, if you don't have any of those things, say, I want to register for a clinic, our staff is trained to do all the registration process, let you know when your clinic's going to be, and then get you here. And then after you get your first dose, we automatically notify you either by phone or email when your second dose clinic is going to be. We actually give you a card when you leave that says, show up at, for instance, Jennings School on Saturday the 7th or whatever, so they know exactly when to come back. So it's been very efficient, and our clinics are really busy, as you can see, but the whole idea is to get people in, out as quickly as possible. So it's been working really well.
It looks really well. So they can call, they can do the VEMS thing, not the VEMS, excuse me. They can do the online. I did notice, and I think it's worth noting, that if you don't have appointments available, your site doesn't show that. So I think some people were kind of like, oh wait, where do I go?
Yeah.
So you have to kind of wait and just keep checking back.
Exactly, and we do that by design very early in the pandemic that if we scheduled the clinic, and there are a lot of other providers who did this, they'd schedule clinics for 600 people over a week-long period, and then they wouldn't receive the vaccine. And then they have to cancel all those appointments. That causes a lot of confusion, people calling, why did you cancel my appointment, and so forth. So we don't actually schedule our clinics until we have the vaccine in hand. So we put our order in, we get notification of how much we're going to receive. When we get it and put it in our refrigerator, we go live with our posting. So it is only up there for a short period of time, but I think it's worth mentioning the fact that before we make it available to the general public, as I said, we focus on distinct populations. So, for instance, for the clinic we're going to be having on Sunday at the Waterford Public Works Complex, we sent the link out to our chief elected officials, senior centers, and so forth, and encouraged them to reach out to people in the community that may not have gotten the vaccine yet, or people that they know need assistance.
Right.
So we did that for a few days, and that didn't fill up the clinic, but it filled it up about halfway.
Okay.
So we just went public this morning with the link for the general public, so anyone who's eligible can go to that clinic now, but we want to make sure that we get to those populations. If we just open it up to the general public, it'll fill up in a half an hour. And that's great, we're getting to people, but we want to make sure that we're equitable in vaccine distribution. That's one of our primary concerns.
One of the things that, and I know it's an issue, and it's just, it's hard to handle, and I had asked Chris earlier about it, was the people who are actually totally homebound. The seniors who are actually very much homebound. We have a couple who we have on standby at Groton Senior Center, and when you guys can, I know you will, make it happen. But right now, what is the status of helping those who are actually totally 100% homebound?
Yeah, it's a very difficult question, as you can imagine. Mobilizing our team into what we call strike teams to go out into the community, it's very time consuming, and we're talking about kind of bang for the buck. How much time can we spend going house to house, and how much good are we doing? Yes, we're definitely addressing those individual needs, but at a clinic like this where we can do 600 people over 4 hours. So the Department of Public Health currently has a subcommittee that's looking at that. I know some health districts have already started to determine if they can do that, and that's one of the things we're hoping to be able to do once we get these hospital systems to take over that, those educational responsibilities. It frees us up more to do those more targeted strike teams to go into, for instance, people's homes who are homebound and so forth.
I would imagine that doing this strike team type of effort also would be hard with the vaccine, because you do have to have it refrigerated, you do have to have it bubble wrapped, and that could probably be an obstacle for you.
It is. So it's also, it's chain of custody, it's keeping it cold, it's when we pierce a vial, we have to use it up in a very short period of time. When we drop the vaccine into the needle, into the syringe, we have to use it up very quickly. So just like at these clinics, we only drop the amount of vaccine that we need, but there are times, because there are 10-dose vials, where we'll give the last 2 vaccinations and we have 8 doses left. So we have a waiting list that we utilize if we have to call people and say, you got to get down here in a half an hour, we got to get this shot into you.
That's awesome.
Yeah, well, of course we focus on people who are eligible first, but there have been times where we had 3 doses left, and we don't care. We have to get it into someone who can receive it. We haven't wasted a dose out of the thousands that we've given so far, so that we want to keep that record. So
thank you for addressing that, because that is one of the questions I was going to ask you is, what are you doing when there is extra? So the wait list, those are people who've already reached out to you? Yeah,
generally, as you can imagine, if we advertise a wait list, we'd have to hire someone to manage it. But whenever anyone calls or they come to our website and they say, hey, I'd like to get on your wait list, we just put their name, town of residence, cell phone number, and age. And then at the end of a clinic, we prioritize by age. We reach out to the oldest person first.
Excellent.
And obviously, if we were doing it today, we'd want to focus on those people who lived closer to this particular vaccination clinic, because we don't want to keep our clinic open all day where people drive forever to get here. So there's an efficiency to it, but we try to be as equitable as possible.
You guys seem so organized and so well thought out, but I know there was probably a lot of heartache and a lot of headaches over this.
There is, for
planning.
sure.
So I commend all of you. Chris is in the background here doing a wonderful job, and all of your staff and these volunteers, amazing.
Yeah, that's something I really have to emphasize. If you look around the room, everyone who's in blue are part of our medical reserve volunteer corps, and we absolutely couldn't do it without them. And I think this is a good time to make a plug for local public health. We've been underfunded for decades. This year's, the governor's budget is flat. It actually shows a 10% decrease in funding for local health departments. So just imagine a clinic like this where we're vaccinating hundreds of people, the majority of people who are doing the work are not getting paid. And unlike hospitals and pharmacies and so forth, we don't get reimbursed for any of this work. We don't get any kind of reimbursement for vaccine administration.
Really?
Hospitals do, anyone who provides direct medical care. So,
but not Ledgely.
Yeah, but not Ledgely. Not most health districts in Connecticut don't provide medical care. We don't do billing, so we don't have the ability to get that money. So we rely heavily on volunteers. So, but without them, this couldn't happen at the local level. So it's really a perfect example of, public health as a discipline. You hear about it's in the background, but we don't come to the forefront until we have a pandemic, and then everybody says, wow, we need our health department. So we're saying to everyone at the state level and our legislators, fund us.
Fund us, help us.
Yeah, help us to do the work we need to do without relying on our wonderful volunteers. It's great to have them, but the fact that we have to do all this work with volunteers says something about the lack of funding.
It does. Yep. Well, we thank you. We thank Chris. We thank all of you for everything. This is a tremendous service, obviously. Southeastern Connecticut felt kind of neglected, so we're so glad you're doing these clinics. If somebody wanted to reach out to you, to Ledgely, not to you specifically, what's the number to call to get that help?
It's 860-448-4882. Happy to talk to anyone if you have any questions or concerns.
Thank you, Steve, so much. I really appreciate it. This is fantastic, and keep up the great work.
Thank you very much.
Thank you very much.
Thanks, everyone.